Today's video, we'll be discussing some important MRCP questions and their explanations. Understanding these cases is crucial for medical practice, so let's dive in. Question 1. Question. A 70-year-old man presents with progressive difficulty in swallowing both solids and liquids. He has lost 10 kilograms over the past 3 months. What is the most likely diagnosis? Answer. Esophageal cancer. Explanation. Progressive dysphagia, or difficulty swallowing, that affects both solids and liquids, along with significant weight loss, is highly suggestive of esophageal cancer. This is a serious condition where early detection and intervention are critical. Weight loss indicates a significant underlying pathology affecting nutritional intake and overall health. Question 2. A 35-year-old woman presents with palpitations, sweating, and tremors. Her thyroid function tests show elevated T3 and T4 levels with suppressed TSH. What is the most likely diagnosis? Answer: hyperthyroidism. Explanation: symptoms like palpitations, sweating, and tremors, coupled with elevated levels of thyroid hormones T3 and T4 and a suppressed thyroid stimulating hormone TSH, indicate hyperthyroidism. This condition results from an overactive thyroid gland, which increases the body's metabolic rate and leads to the symptoms observed. Question 3. Question. A 50-year-old man with a history of chronic alcohol use presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Answer: Wernicke's encephalopathy. Explanation: the classic triad of confusion, ataxia, lack of muscle coordination, and ophthalmoplegia, eye muscle weakness, in a patient with chronic alcohol use suggests Wernicke's encephalopathy. This condition is caused by a deficiency in thiamine, vitamin B1, and is a medical emergency requiring prompt treatment with thiamine supplementation. Question 4. Question. A 25-year-old woman presents with a history of recurrent oral ulcers, genital ulcers, and uveitis. What is the most likely diagnosis? Answer: Behçet's disease. Explanation: recurrent oral and genital ulcers, along with uveitis, inflammation of the uvea in the eye, are hallmark features of Behçet's disease. This is a systemic vasculitis that can affect multiple organ systems, leading to significant morbidity if not diagnosed and managed appropriately. Question 5. Question. A 60-year-old man presents with a history of chronic obstructive pulmonary disease, COPD, and now has increasing shortness of breath and ankle swelling. What is the most likely diagnosis? Answer: congestive heart failure. Explanation: increasing shortness of breath and ankle swelling in a patient with COPD suggests the development of congestive heart failure. This is often due to cor pulmonale, which is right-sided heart failure secondary to chronic lung disease. This condition occurs when the heart struggles to pump blood effectively due to the increased pressure in the lungs. Conclusion. Thank you for watching.